We've been performing breast and body surgery for the past 15 years or so. The whole point of augmentation is really achieving better shape, restoring fullness, improving the general proportions of one's body and shape. Obviously a lot of individual factors in decision making, and a great deal of what I do is trying to really explore what is it that one is trying to achieve, and really what can we do to accomplish those results. Well, the major categories of implants are saline or silicone gel. I would say that in our practice, we very rarely use saline implants. I do think that there's some real consequential differences in terms of feel and appearance. We favor a silicone gel due to its incredibly natural feel and look, if you will. Within the grouping of silicone implants, the greatest variation is what's called cohesiveness. There are implants that are more cohesive or less cohesive. The gummy bear would be the example of the most cohesive implant. This is the firmest gel, if you will. So think of it as Jell-O, one being soft, one being medium, and one being very firm Jell-O. The gummy bear is the firmest of the group. The implants we use have a line that is in the middle called the extra line that are a little more cohesive and have maybe a little more shape consistency, if you will. We always use smooth implants. I think there's good reason for that, and that's something we can discuss during the consultation. The concerns over implants that have been coming up over the past years are entirely related to textured implants, which we have never used and do not use, so that eliminates those concerns as well. Well, very individual decision. The best candidate for augmentation alone is someone who does not have any consequential droopiness. If there is droopiness to the breast tissue, augmentation alone rarely is the solution. It does not result in necessarily the very best aesthetic outcome, but someone who has perhaps not a lot of natural breast tissue and wishes to have some enhancement of that tissue is an absolutely ideal candidate. Yes, a breast lift is really essential in achieving aesthetically good results with breast surgery when it's indicated. And there are many ways we look at what defines droopiness in the breast. There are many guidelines and measurements we look at, but looking, of course, it can be inherently obvious. If the nipples are low and they're below what's called the inframammary fold, that's a good indicator of, is there droopiness? Can you hold a pencil? If you can, they're probably droopy. And you're not going to achieve good results without addressing that, and that's where lift comes in. Well, we have our facility at Caroline Point, very private, great facility. We have the very best people who work with us. We make this very seamless. Come in that given day. Nurses and anesthesiologists interview you, a little bit of medication. Next thing you know, you're on your way home. So we make this very safe, seamless, and very private experience. With the augmentation is surprisingly quick in recovery. There is essentially no bruising and minimal, if any, swelling associated with this. There's generally not a lot of discomfort. It's more of a tightness feeling rather than pain per se. I would say my average patient actually does not take a lot in the way of medications afterwards. One can be up the next day, driving later the next day. There are some obvious restrictions, not a lot of very heavy lifting above chest level for a short period of time, but really resuming many normal activities fairly quickly. Many individuals can be back at work within a few days. This is a very interesting question. I suspect there's something on the internet that talks about having to replace the implants every 10 years or so, which I don't quite understand. Breast implants, particularly modern implants, and we use Mentor as the exclusive company. They're the only implants made in the United States, incredibly well made. As long as everything is stable and fine, there's absolutely no reason to touch the implants. They do not need replacing, like, I don't know, tires in a car or something. Just never figured out where that came from. The augmentation ranges from about $6,500 to approximately $8,500. It is based on the implant used to a great extent. The different cohesive style of implants can add some dollars simply in the cost of the implants. Basically, we have been in practice for a lot of years. I believe we spent a great deal of time and effort at analyzing what we're doing, really maintaining the state-of-the-art of options and techniques for an individual. We conceptually look at everything and treat it in a very gentle and yet effective fashion. We are highly individualized as to what we offer. I believe that what I can do is look at an individual and really bring my expertise of many years and what is happening, what are the changes that make sense, what maybe doesn't make sense, how do we really structure a plan that is ideal and will achieve ultimately the greatest results. Well, basically, the assessment, we have many tools for assessing. One of the truly valuable tools that we have at Northwest Face is the Vectra XT imaging system. This is an extremely high-tech, real-time, three-dimensional imaging system that is used for breast and body imaging. What we're able to do is take an image utilizing multiple cameras that are then processed, and we now have the ability, we have your image captured, and in real time we can do volumetric analyses, we can do extremely detailed analysis of position, where everything is, and then we can, on the computer, we can project what do things look like if we do a lift, if we do a reduction, if we now add volume. We can actually add implants by actual serial model number of the implant itself. So I can take an individual's image and we can put in, say, a 350 cc Mentor moderate plus smooth round gel implant, and we will see what that looks like. And so one of the biggest concerns that someone coming in, say for augmentation or a lift and augmentation, is, well, what do things really look like? I don't want to look ridiculous, but I also don't want to maybe underdo it. So how do we really judge that? And the Vectra system really allows us to answer a lot of those questions in the very best possible way.